So what is endometriosis and how does weight affect it? I'm Zainab, I'm the pharmacist from PillSorted Pharmacy, and I'll cover what it means, what are the symptoms, how does losing weight benefit, and has the GLPs got an effect on it. Endometriosis means tissues similar to the lining inside the womb grow outside of it. They can grow anywhere. Usually it is in the pelvic area. They're tricky because they respond to female hormones and they can create hormones as well. Why is endometriosis important? For two reasons. Because 1 in 10 women get affected. In the UK, that means over 1.5 million women in their reproductive age. And it is one of the reasons for infertility. So what are the symptoms that it causes? Because these tissues respond to our female hormones, they can get swollen, they can erupt and cause bleeding, they are quite painful, and depending on where they are, they can cause effects in there. So usually it is a lot of pelvic pain, so it's as if you're wearing a tight pant all the time, and it can cause pain for your periods, during sex, during toilet, and it can leave you really tired and exhausted. And how do we diagnose it? That's the tricky part in it as well, because it takes over 10 months to be diagnosed with endometriosis. So it's a lot of tests involved. You do need to be persistent. You do need to show up for your body and keep on getting over those dismissals, but talk about the symptoms and ask for diagnosis. It will involve either ultrasound or MRI as well, but be ready for lots of different tests. What are the treatments? Well, there's no complete cure for it, but what we try to do is to manage the symptoms either with pain relief or with hormones or with a combination of both. I want to talk about losing weight and how that can affect. So there's 3 important things that losing weight can affect the endometriosis. One is when you lose weight, the amount of estrogen is regulated and reduced. That can have a good effect in managing the inflammation of the endometriosis tissue. The other one is the adipose tissues, the fat tissues, release a chemical that causes this chronic mild inflammation in our body. So by losing weight, we're reducing another reason of the inflammation that happens in the body. It means you feel less tired. And the last one that weight loss can affect is when you can move easier, it can help you with that pain management and resilience. So the GLPs are not prescribed for endometriosis, but they can affect losing weight and they can support your metabolic health. They can have a improvement effect in your endometriosis symptoms. And what do you need to look out for? The key important thing is about pregnancy. It doesn't mean women who have endometriosis cannot get pregnant. It just means it'll take longer. So plan for it. Definitely get all of your medications reviewed, especially there will be different treatments for your pain and for the hormones when you're planning to become pregnant. Some medicines might not be suitable during pregnancy, like the GLPs. So you do need to leave a washout period for that too. And the other things to look out for, if you feel the pain is becoming worse, especially in the mornings, if it's causing you to feel sick, if you've got spot bleeding, if your period pain is getting worse, all of those are important things to consult with your doctor and specialist. As a recap, endometriosis is a condition that affects 1 in 10 women. There is help out there. Reach out to us for that clinician-led health advice as well. Thank you.